I'm excited to share with you my interview with Casey Holstein, co-owner of Synergy Home Care Services. During the interview, Casey sums up the array of services home health agencies provide, as well as tapping into resources that are often overlooked by family members and elders. Some of these include long-term care insurance, employee assistance program, and veteran services. So please stay tuned. Welcome, Casey. It's really a pleasure to have you here. I know we met up a few weeks ago and you shared with me about your experience overseeing a home care agency. So please share with us about who you are and what you do.
Hello, everyone. My name is Casey Holstein. I am co-owner of Synergy Home Care Metro, New Jersey, which is a non-medical home care agency providing care to the elder community here in northern New Jersey, specifically Essex, Union, Hudson, Passaic, and eastern Morris counties. We've been in business for 15 years right now, and it is a pleasure to be here, Harlan. Thank you very much for welcoming me.
Thank you. Thank you for your time. So, share with us, what do you do at Synergy Care? What sort of Synergy Home Care, I should say? What sort of services you provide?
So, Synergy Home Care in the non medical world provides care to the elderly. We do some child care as well, but it's really helping the elder community live safely and independently in their residence of choosing, whether it's their private home or if they're an independent and or assisted living facility. And it's giving them dignity, safety, sort of one-on-one services that they need to get through the day and get through the weeks, the months, and the years in a safe, in productive, dignified environment. And we provide certified home health aides that go into the various residencies and can help the clients, patients, we really call them clients, from the moment they get up in the morning to the moment they go to sleep at night. And if they need care in the overnight, we can provide that as well. But it's pretty much everything that they need to get through the day.
Okay, wonderful. So, in a lot of my other interviews, there were discussion about the point to which we look for care for an elderly parent or aging parent. Mm-hmm. And I know that there's a lot of challenges with that because all our lives we're raised to be very independent, right? So tell us about that experience. What is that experience like for families? Meaning, what point do they then seek out care or come to you for care?
So I think in these times, people are they are living a lot longer. Mm-hmm. They're living longer, they're being more productive, they're living more independently, they're traveling more. But at a certain point, we all slow down, mm-hmm. right? Many of us fall, many of us have illnesses, incidents like a broken hip or knee replacements or things like that. And at a certain point, we all need help in life. When you're in the later stages of life, you need a little bit more than you do when you're younger, so to speak. And I guess the one bit of advice that I would give all families, regardless of the situation, is to be open-minded and have a discussion about what mom and dad or grandma and grandpa, whoever the person is, want as they age. Mm-hmm. Do they want to stay in their home? Can they stay in their home? Do they want to go into a facility, an independent care community, an assisted living? The mm-hmm. phrase nursing home, which was bandied about when we were growing up, is not used as much anymore. Mm-hmm. But it's really what your desires are. Mm-hmm. And again, having that conversation and keep refining that conversation in the years beforehand is very, very important.
Yeah. I'm getting the sense, through these interviews, that seems to happen less. And we would like that sort of discussion to occur earlier and more frequently. So share with us some of what you have done as an agency to convince or to sort of help families. So give us sort of a case study or scenario.
We've built our agency and numerous other agencies have built their businesses on being a resource. Mm-hmm. It's very hard to go out and knock on a door and say, choose me as your agency. It's really putting yourself out there, letting the healthcare community know that you are a responsible entity in the healthcare continuum that we all travel in. And we've built our business on helping people the way they want to be helped. So every family has their own plan, they have their own budget, they have their own life way. We all know families that are very together and on the same page and close knit. We also know families that have been broken apart by various incidents and lifestyles over time. And not everybody's always on the same page. What we try and do at the time of need, when we're pulled in or invited in, is to talk with the sons and the daughters and the patients, the clients, about what they want and present a realistic picture of what your insurance plan can pay for, what private funds you have, what assets you can deploy, what you expect the government to pay for in terms of Medicare, Medicaid, utilizing veterans benefits, utilizing sort of some of the, and I say assets not in a financial way, but some of the lifestyle choices that you've made in the past and how they've been brought forward to help you today.
Okay.
Right?
Yeah.
That's what we try and do. We counsel. We try and counsel.
Yeah.
And I think everybody benefits from that because it opens up the realities of the current situation. We're not hiding by it. And if you start if you lie to your doctor, the only person you're hurting is yourself.
Right.
Right.
Yes.
And so we try and tell people that.
Yes.
Be honest with us.
Yes. That's actually a great point. And I remember what I took away from our initial conversation was, and I think you just alluded to that, about tapping into previous jobs or benefits that you may have, or I say as a veteran, or long-term care. So can you just share with the listeners a little bit more about that based on your experience? Like, how can people leverage what they already have to then be able to provide this type of service?
So we are a concierge private pay entity. And in doing so, my agency does not utilize Medicare or Medicaid services. We're not licensed to do so. There are other agencies out there that are. The problem is you don't get as much as you think you get from that. And if you're getting a lot, it means you're in really bad shape. And not everybody's in really bad shape. But what we have affiliated ourselves with are certain relationships, such as the Veterans Administration. If you are a veteran, and there are many veterans out there that qualify for home care services or at least prescription plans and medical care through the VA. And in the past, the VA was, I say this somewhat tongue in cheek, they were not nearly as good as they are right now, because right now they've gotten a whole lot better in caring for those who've served our country. We also utilize long-term care insurance, which is a product that is many people have, and long-term care insurance pays for what we do in terms of in-home care. It pays for assisted living, things along those lines. It pays for help for you. It is a financial product that, unfortunately, when you pass, it stops.
Okay.
It is not an asset that gets passed down to the next generation or your heirs. So we strongly encourage people to research if they have it, if their loved one has it, and how to best utilize it for the loved one. We also do a lot of work with employee assistance programs. Many large employers, mostly in the private sector, private public, value their employees, and they've purchased over the years these perks that can help provide emergency care for a loved one who has to go to work, and mom or dad or their children need to go to school or have to stay home or whatever and can't be there. So they provide these benefits to their employees, and we help counsel people on family members who may have those benefits and how to best deploy it. So what we do is we sort of build a whole picture of where you might be able to gather support in the need of care.
Wonderful, wonderful. Thank you for sharing that. I think that for a lot of our listeners, they may not be aware of these type of services. I was talking to a doctor who specializes in gerontology, and he was also unaware that where he works, this services is available as well. Part of this is, as you were talking about, sort of the counseling is the educational component to it, right? Providing this information to help the families make more sort of informed decisions. What type of dynamics have you encountered with families going through this process, deciding, or maybe I should say, ask, what works well? What you have seen, what works well?
What works best, regardless of budget, is understanding reality, is understanding where the patient, who they are, what they're going through, and how and what's where they're at. Really, that's probably the best and number one piece of clarity that everybody needs. Be realistic that mom and dad may have a cognitive disease and you think they're still okay and they're really not okay. Right. And understand also the toll and wear and tear it takes not only on the family, but on the extended family.
Yes.
Right? There are a lot of sandwich generations that we deal with out there with children, with people having children, starting families later on in life. You can have an 80-year-old parent. You can be, 50 yourself. You can have kids in elementary school, right? Running your own business, being a supportive spouse, partner, whatever. And you're being shredded in every direction. And whatever issues your elderly loved ones have will overtake everything else.
Yes.
Okay?
Yes.
And this is something that is very, very important and something we very much need to be aware of. And in doing so, we help people understand where they're at. Are we perfect for every family or every situation? No, we are not. There is no such thing as perfection in this. It's just dealing with on a daily, weekly, monthly, yearly basis. But what we do is we help people adjust to the ever-changing dynamic of healthcare in the elder world.
Yeah, I think that's a great point. In public health, we use the terminology or the model that we use is called harm reduction. And harm reduction is meeting the patient where they're at and seeing them for who they are. And it's interesting because seeing the patient for who they are and where they're at, but I think, and it happens with not just the elderly, but just in with diagnosis as well, educating the family. Like, this is what your reality is. This is what we have to deal with. And I think the point that you made about the sandwich generation, right, where mom, 80-year-old mom, her need is so overwhelming, and we're stretched so thin. So having the services you provide and all the other resources that families may not be familiar with to sort of help them in this journey, in this journey of healthcare, I think is really, really important. The other thing is, can you give us like scenarios about something that was maybe challenging or really took you off guard, perhaps, or without disclosing who they are, or
Sure. I mean, we've taken care of a incredibly wide variety of families and patients over the years. And every care plan that we've ever designed, we've tailored uniquely because there is definitely not one size that fits all. Every family has a unique dynamic. There is a lot of love in certain families. And then one of the families that we took care of, they had 6 very successful children, but only one of them wanted to be engaged with mom because mom apparently and dad, who we didn't know, were horrible parents. We see that. We see a lot of families that are very much together and just everybody is in on every decision. Right. And as I've said over the years, in the elder care world, in the world that we live, everybody has an opinion. And every opinion needs to be respected and heard. But it's not the only opinion that matters because there are a lot of dynamics. We've had family members who just refuse services, right? And the kids are like, listen, if you don't let this person in, I'm never talking to you again. And the kids say that, right? You have to scare them, right? You have to scare mom and dad. We've had clients who have asked our caregivers to leave. We've had the police called us on a number of times because people will wake up in the middle of the night and they're like, there's a stranger in my house, and the lady will call 911 and the police show up and like, what are you doing here? And it's my caregiver. And I get a phone call and I've got to go out at 3 a.m. and say that. And I joke, I've had the police called on me maybe 8 or 9 times in the 15 years I've been doing this, and I'm 8-0 in terms of my one loss record of understanding that. We've traveled with families on vacation.
Really?
We've traveled with a gentleman over the years who wanted to sort of, at the age of 80 or so, sow his oats down in Florida with some former conquests.
Wow.
That was a lot of fun. We had an interesting time with that. We make a difference in people's lives. We make a difference. And if you have one-on-one care, whether it's tutoring, whether it's a personal trainer, whether it's investment guidance, whether it's sort of anything in life, if you get that one-on-one, your success rate is, for the most part, will be better.
Yes.
Right?
Yeah.
Your yield will be better. And that's what we try and instill in families. And so it's just in the 15 years, again, that we've been doing this, we've met a width and breadth of people across all genders, gender fluidity, races, and every person is unique in their own space.
Yeah. When you mention about your service provider, your aides with the parent or the elderly person call 911 or call the cops to see a stranger in their house, I guess walk us through that. Like, at what point you don't provide nursing services, right? So say the aide identify that this patient probably needs to go to the doctor. Do they accompany them to the doctor as well? Or?
Absolutely.
Okay,
absolutely.
Yeah.
So I mentioned that we can pretty much take care of anybody from the moment they wake up to the moment they go to sleep, and overnights as well.
Yes.
We are there to help them basically get out of bed in the morning, take care of their personal care business, brush teeth, assist with bathing, meal prep, med reminders, companionship, socialization, taking them to the doctor, walking down the street with them, taking to an exercise class. A lot of times a son or a daughter will take mom or dad, I'll use that as an example, to the doctor, and they'll drop them off, and our aide will be dropped off on the curb with the patient, and the daughter will go park the car and accompany them in.
Okay.
Other times we've Ubered people or lifted people or, gotten transportation to the doctor with the aide, and the aide will FaceTime the son or the daughter in the doctor's office to have a real-time telehealth in-person / visit as well. We're the eyes and the ears. Often we make recommendations because we're there every day. We see mom not eating. We see mom getting agitated. We see mom or dad getting tired, declining, or getting better. And we're there. There's a lot of, in this age now, where people are raised here in New Jersey, but they go off and they live in California or around the world in this global place that we're really living in now. They don't get to see mom and dad as often. And so we become sort of a de facto family member in a certain way.
Yes.
And we impart information to our nursing staff. And we do have nurses. We don't technically do skilled nursing, which is like wound care, but we do everything to prevent that. So it's really the attendance, it's the adherence to daily health care, self-care. Make sure they take their medicine, make sure they're well hydrated, make sure they're clean, make sure if they're wearing briefs or they have an incontinence issue, making sure that changed. They're not sitting in a soiled piece of clothing. Getting them exercise, listening to music, getting them socializing, getting them out on a beautiful 70-degree day that we're sitting here recording this podcast. That's what we do. Activities of daily living, and with emphasis on living.
Yes, yeah. So I know that, and thank you for providing that sort of report, I guess, daily activity reporting form that you have your caregivers complete. So you talk about observing the patient, observing whether they're improving or declining. And how does that then get communicated to the provider through you all?
To their doctor?
Yes, the patient, the elder doctor.
So very few of our clients are on an island of their own, meaning they have no family members or loved ones. So we're usually engaged or invited into the relationship by a family member and we keep involved in the daily, weekly dynamics of the patient. We we're in contact with their doctors. We have a list of all of our patients' doctors, and we'll let them know. And we'll encourage the patient, if there's a decline, to speak to their doctor, or
Okay.
if they're retaining water, maybe you up sort of the diuretic. If there's a lot of telehealth happens nowadays, we're very, very accommodating. We're very proactive in making sure that people know what's going on. With software in today's world, we can do scheduling that the families can see who's coming to take care of their loved one.
Oh, wow. Yeah.
Right. And there's care notes, and there's access. There's complete access. We invite every family member and every patient to come to our offices and see our layout, which I strongly encourage every provider to do, because it just gives you a sense of comfort, or maybe discomfort. You didn't know who's providing care for the loved ones. So we are fully transparent in terms of care for the patients.
Yeah. I didn't even think about that, the issue, because of the modernization of access, right, to these apps, and to see the type of appointment and service you provide and who's coming and when they're coming. I didn't even think about that sort of transparency, but that makes a lot of sense, nowadays. And then everyone can see it. You can see it as the provider, the families can see it as well, the patient, if they have access to that. So I guess this is really, really helpful to me, hearing about so many of the services and so many families that you have helped. I guess any recommendations, suggestions for family? How do they go about finding you? What sort of walk us through that process? Like, oh, my mom fell, or my grandmother, and I need a Synergy Home Care Services.
So there's sort of a life cycle to healthcare. You fall, you go to the hospital if need be. The hospital, if you're admitted and you're over the age of 65, you're sort of in the Medicare world now.
Right.
And then you're eligible for rehab, or either in home or in a facility. And at a certain point, you're on your own. Okay. But you still need the care, right? So my job as the marketer and face of my agency is to educate the healthcare community of the resources that we provide. We're online. We've got a whole website and the Google world of, and our name is out there, and we advertise in various publications, and we let people know who we are and what we do. They reach out to us. I sit down and I have a conversation with them about, this is who we are. This is what we can provide. These are the realistic costs of care. Our relationship it can be for one day. It can be, our longest client was a woman we cared for 11 years.
Wow.
Around the clock for 11 years. We've taken care of people who don't have a lot of assets, and we've taken care of billionaires.
Wow.
Okay? They need care, right? And in this day and age, with pharmacology, with technology, with the telehealth that we've touched on, with people just being more aware of their health, people are living a whole lot longer. And we talk about robotics and sort of removing the human element of care for the elderly. I don't see that happening anytime soon.
Right.
You still need somebody to care for them, right? And with cognitive issues, Alzheimer's, dementia, Parkinson's, and things like that, people have moments of clarity, people have moments of fog, right? And you have to be there along the journey to recognize each one and help them. And we put ourselves out there as a resource, right? We speak, we do community events, we do podcasts such as this to spread. And I tell people all the time, give me a call. If you've got a question about elder care services, whether it's immediate or it's a year from now, you see a change in mom or dad or grandma and grandpa. Because, again, going back to the first question you asked me, have a plan.
Yes.
Have a discussion.
Yeah.
So.
Yeah. Recently, I had a conversation with someone, and they talk about the different access to care, health-seeking behaviors among the elderly, policy issues with regards to Medicare or Medicaid or insurance companies, etc. What would any recommendations, suggestions, anything that you would like to see that needs to be changed? from your perspective, through your lens as a home healthcare provider? It could be finance, medical, or legal, or whatever, based on your experience.
I think the ounce of prevention versus the pound of cure cliche is very important. The healthier we are and the nicer we are to ourselves, the better life we will have, right? And you and I, before we started recording this, we talked about your previous conversation with somebody about Medicare and prescription drugs and things like that. So the ounce of prevention, right? If we can get people to be healthier ahead of time, and smoking, the decrease in people who smoke is helping that, right? The adherence to exercise, just keep pushing that. The government is a large, slow-moving entity, and it's hard for them to sort of quickly turn. And if you're going to rely, if you have means, okay, if you have means, which is not everybody does, it's hard to find a better value in spending those means than on yourself, I think. In my world as an elder care provider, there are a lot of people out there with a lot of money, okay? You're not going to, at 80 years old, you're not going out and buying a new car all the time. You're not going out and buying a new boat. If you have that money, spend it on yourself, whether it's me or with another provider. If you want to go into a very nice independent living facility, then do that. Right. If you want to stay at home, do that. But sort of recognize that